Welcome to the Authority Podcast, Plumbing and Mechanical. When talking about the built environment, we would do well to remember, we shape our buildings, and afterwards, our buildings shape us. Therefore, on each episode, we'll discuss the latest trends from IAPMO in plumbing and mechanical safety, sustainability, and resiliency. Join me, your host, Christoph Lohr, and together we'll explore the ways we can make our buildings shape us for the better. And we're back to the Authority Podcast, Plumbing and Mechanical. In this episode, we talked to Dr. Abraham Cullom, a microbiologist with expertise in plumbing systems. Dr. Cullom discusses the actions of various U.S. federal government agencies requiring water management plans to address the risk of Legionella and other waterborne pathogens in federal buildings and healthcare facilities. Dr. Cullom explores the wider implications of these policies, why they are emerging now, require personal expertise and certifications, and how to set standards that ensure compliance with a variety of regulations. Dr. Cullom, or if I may call you Abraham, welcome to the show.
Hey, yeah, thanks so much for having me.
And it's okay if I call you Abraham, or would you prefer Dr. Cullom?
Abraham's great. Most people call me Abe, but I'm not picky, honestly.
Excellent. Well, we'll go with Abe. So let's dive right into this. What is the significance that the General Services Administration, or GSA, and other federal government entities like the Center for Medicare and Medicaid Services are taking the risk of Legionella in water so seriously? Maybe even want to provide some context for our listeners about Legionella in general.
Yeah, thank you. It's very significant because this is a serious issue, and sort of sum of efforts by industry organizations and federal entities like CMS and now GSA really are having a positive impact. So what we're talking about, Legionnaire's disease, it's a type of pneumonia caused by that type of bacteria you mentioned, Legionella. Large majority of that's caused by one species, Legionella pneumophila. Nailing down the risk of this, or talking about risk of this, is kind of tricky because these are bacteria that are naturally occurring in freshwater systems, lakes, rivers, very low levels, generally not a concern for human health. Can't even be found in drinking water distribution systems. In a well-maintained system, again, pretty low levels, not really a concern. But once they get into a building, that sort of man-made environment with water that may be warm, sitting stagnant for long periods like overnight, plenty of other bacteria to commingle with in that ecosystem, then they can really take off, start growing, and start being found much more frequently. So that's sort of where the risk of infection comes in. It's a very common bacteria. We think it's present in roughly 50% of all large buildings. So many people listening to this have probably been exposed to Legionella in some way. And I suspect that millions of people are somewhat regularly exposed to Legionella without that leading to any sort of disease. So they typically only cause serious disease in elderly or immunocompromised people. But when they cause disease, the disease it causes, called Legionnaire's disease, is very serious. Many people acquire it while they're in a hospital, and in that context, it has a fatality rate of 30%. So what we're talking about is something that can be very, very serious. And historically, it's been something that's been growing a lot. So cases of Legionnaire's disease, since the mid-90s have been growing exponentially. I mean, if you model this, it fits an exponential curve very, very well, growing by a factor of like 9 in less than 20 years. So we have this bacteria, this issue, and this disease that seems to be growing. ASHRAE standard 188. This is a voluntary standard to sort of minimize the risk of Legionella growing in those building water systems. That comes out in 2015. CMS sort of adopts it in 2017, and sort of a lot of other players step in to do the hard work of controlling this issue. So COVID happens. There are changes in sort of the official reporting and definition of cases. There's a bit of lag in these policies actually sort of manifesting. But if you look at data from 2021 on, it actually showed that not only have we arrested that exponential growth, but Legionnaire's disease case numbers may actually be trending down. And I would attribute at least a portion of that to the growth in these water management practices being enshrined by CMS and now GSA policies. So it's a very serious disease. It's very tricky to handle because we're talking about a very common bacteria. but we have people and organizations stepping in to handle it, and they're getting results. That's why it's so significant.
So, in your opinion, then, what got us to this point where so many government agencies are mandating better water management plans for their facilities?
So these water management plans, that is basically what is described in that document I mentioned, ASHRAE Standard 188. That is a document, a building, a facility might have that lays out everything they got to do to keep their water system running in good condition to limit the growth of Legionella. I think why we are here now is related to a lot of growth and awareness around sort of the seriousness of this issue, kind of analogous to what happened with lead. Until the DC lead water crisis in the mid 2000s, I think when people thought of lead poisoning, they thought of paint. Treated drinking water was not really as much of a concern. Now, when people think of lead contamination, water is maybe the first thing that comes to mind. So something similar kind of had to happen for drinking water for these sorts of infections, particularly in hospitals. So, we have prominent headline-making outbreaks of Legionella and other waterborne pathogens from, clean drinking water, better tracking of the thousands of other cases that are not represented in those big stories, leading to this awareness of infections from treated drinking water. And while these are rare, kind of letting us know these are something that we should at least have an eye on. That trend started, since the Bellevue Stratford Hotel, the outbreak of Legionella that put it on the map in 1976. But when the first standard for controlling Legionella, ASHRAE 188, comes out and other guidance around it, trickles out later, now, we as a society, we have something we can do about this. And the fact that hospitals are such a large source of concern because they have more vulnerable populations, more elderly folks, more folks that might be immunocompromised in some way. They have very, large, they're big buildings. They have complicated water systems. I suspect that sort of explains the emergence of the CMS memorandum on Legionella water quality, and how, we get to this growth of water management practices in the healthcare industry generally. GSA is a little more interesting because the GSA is largely, not healthcare. I think the development there is really driven by this growing acknowledgement that certain water quality issues are really a shared responsibility between utilities and building owners. By that, I mean the utility can do a lot of things to ensure that issues like lead and Legionella definitely do occur, but they don't necessarily have the control necessary to ensure that certain issues like Legionella never occur. So a utility can provide you with the best, cleanest drinking water in the world. But if you do certain things, you let the water hang around sort of warm, nice bath water temperatures like 100 degrees Fahrenheit, stay really stagnant for long periods, days and days. Legionella is going to be able to grow in the building anyway, despite what the utility has delivered you.
Gotcha.
So yeah. Oh no.
I was going to say, so just for our listeners, one of the questions that I think, just to kind of get some quick clarifications, kind of 3 quick items here. So water management plans, what you're talking about is basically a proactive plan and program that it's just something that the owner's doing to try to proactively manage the water in their facility, right? To try to prevent, and there's any number of solutions to it, but they're trying to do something active to prevent waterborne pathogens like Legionella to grow. Is that correct?
Yeah, I think that's the cleanest, briefest way to put it. You have a lot of folks within the building that, they understand the water systems. They understand, infections. You might have infection preventionists. You have administrators that want to do something about Legionella. The water management plan describes everything those folks got to do to basically do the activities that are going to actually manage Legionella growth in the water system. So that is going to be, monitoring certain things in the plumbing, testing for Legionella, perhaps, everything those folks need to do to actually control the issue.
That makes sense. And then CMS, so the Centers for Medicare and Medicaid Services, for healthcare, correct me if I'm wrong here, Abe, and they tied funding to having a water management program. So if you're a healthcare facility and you get CMS funding, you have to have a water management program in place. Is that correct?
Right. So they, in 2015, ASHRAE Standard 188 comes out, which sort of establishes these are sort of the core elements of what has to go in that water management program. Just 2 years later, 2017, which, sounds long, but this emerged in 1976. So something coming out only 2 years later in the grand scheme is pretty quick movement. 2 years later, CMS puts out a memorandum describing basically that you need to have some sort of water management practices in place for Legionella, and sort of makes reference to ASHRAE 188. Everything sort of that has come out since has made, or not every, most things that have come out since have made some reference to ASHRAE 188. It's a very short document, but it's very important within the grand scheme of Legionella control and regulations and guidelines. It's really the backbone of a lot of this stuff.
That makes sense. Now, the GSA requirement, kind of going to some of our next questions here. The GSA requirement was different than the CMS one, because the GSA requirement said that, I guess it said about having water management practices, but then it even said that you needed a certain credential, an ASSC 12,000 series type credential, for one of the professionals working on your project. Can you expand on that a little bit, and then touch on how that GSA requirement strengthens water quality efforts in federal buildings, and why that initiative is crucial to mitigate the risk of Legionella in water?
Yeah, of course. So that certification, ASSE 12080, that's a certification for Legionella management in building water systems. Essentially, it's the basics of everything you need to know to start to mitigate Legionella risk in building water systems. It's specified as a component, sort of expert that need to be brought in certain stages to sort of, help deal with Legionella issues or sampling within building water systems. And I think it's a good add there, because it sort of ensures a minimum level of understanding for people who are going to be involved in this and people who are going to be tackling, this important issue of Legionella being present in buildings, which is, exactly the goal of that sort of certification. How their activities sort of strengthen water quality efforts. This is a big step, because basically everything I have talked about with water management has been relatively siloed within healthcare, since the beginning. So the requirements mostly apply to healthcare. A lot of the guidance was developed within the context of healthcare. A lot of studies, or the large majority of studies of like Legionella growth within a building, are happening within healthcare. So a lot more surveys of hospitals than office buildings. The GSA, what they're doing is implying water management practices and monitoring of Legionella outside of healthcare at the biggest scale I think we've ever seen. So it's a big deal. I'm not a government employee, but I think anyone who is interested in Legionella, is excited about that. Specifically, how this is sort of strengthening things. By testing for Legionella in thousands of buildings, they're going to identify what buildings are all good as is, what buildings need more effort on the water management side, engineering, temperature, sort of moving the water. This is very significant because we typically talk about Legionella with outbreaks, lots of people getting sick, but the large majority of cases or infections are sporadic, so they aren't associated with some sort of cluster. So this sort of dispersed monitoring, I suspect, is going to be very helpful for just getting a greater understanding of how to protect people in general. And my hope is that this will lead to engineering corrective actions, flushing water quality data that can be leveraged to manage sort of Legionella better at these sorts of facilities, so these sort of non-healthcare facilities. They're applying this at such a huge scale. They have the opportunity to develop, best management practices for non-healthcare facilities, which are out there to some degree. I think this will be a lot of rubber hitting the road. I think, a lot of people are going to figure a lot of things out about managing Legionella risk in non-healthcare settings.
That makes sense. So does the GSA requirement address other waterborne pathogens beyond Legionella, or is it just focused right now on Legionella?
So indirectly, yes, not explicitly. Other waterborne pathogens have so many, cool differentiating things about them. Pseudomonas aeruginosa, they have these huge genomes. They're very adaptable. Mycobacteria, another one we talk about a lot. It has this cell wall that's 30% of their total cell mass. They're like walking around in these suits of armor.
Wow.
Legionella have this very interesting amoeba life cycle that's very unique to them. But for the large scale factors that we look at for Legionella growth, stagnation, warm water, temperature, biofilms, lack of disinfectant residual, these organisms tend to operate pretty similarly. So tackling these issues for Legionella is going to be beneficial for the control of these other pathogens, just sort of by, I guess not necessarily by accident, but, not an explicit benefit that you get.
Gotcha.
There are some nuances there, but overall, if you integrate Legionella water management practices, that's going to have a positive effect on the growth of other waterborne pathogens generally.
Excellent. So in your estimation, how do orders like this one from the GSA influence best practices for plumbing systems to protect building occupants from waterborne pathogens in general?
I think a lot of that is going to be related to, again, the development of sort of operations and best management practices that are applicable to non-healthcare facilities. So this is going to, a big component of that feed into this thread of operational guidance, gained a lot of momentum during and after the pandemic around minimizing stagnation. There are a lot of organizations that have guidance around this. There's AWWA guidance that sort of came around specifically to address the stagnation issues during the pandemic. And this year, a Water Research Foundation project in this area I found very informative. So I think GSA is going to generate quite a bit of data on what flushing practices are actually working very well. More broadly, I think this is going to spread some industry knowledge like ASHRAE Guideline 12, the Cooling Technology Institute Guideline 159, into non-healthcare facilities. One possible sort of pitfall here is simply taking, what we're doing in healthcare and throwing it at these other facilities. They don't necessarily need that. The risk is much lower at a courthouse that's, not an oncology ward, that's not a transplant ward. So I think part of the process here is going to involve finding, how they can systematically evaluate Legionella results, apply best practices for response while, dealing with the realities that this is a very common bacteria, and these facilities are much lower risk. And then this is going to lead to expansion of that ASSE certification we talked about, which I think, is going to be very beneficial in the long run, because, as I talked about, those other pathogens operate very similarly to Legionella. And I think, over the next decades, they will see their own rise to prominence. So the more knowledge we have sort of around Legionella and building water systems, the sort of easier it will be as we start to manage these other pathogens more actively as well.
That's so interesting to hear you say. And I think it makes me think about the efforts we've had here at IAPMO. You mentioned the AWWA document about guidance for during the pandemic. IAPMO, we collaborated with AWWA on that, and then we turned around and we created a manual, an IAPMO-led effort for safe practices for closing and reopening of buildings. And we also just recently released a construction practices for potable water, which is in one of our earlier podcast episodes with Tim Bartrand, Dr. Tim Bartrand from Esprit, and talking about some of that. So it's so interesting here. You see a similar trend that we're seeing, which is water quality and flushing practices are on the rise. And it seems like, as all these practices are being discussed along with ASSC 12,000 series, education, this seems to be a really incredibly emerging consideration. And so as we're getting here towards the end of our time together, as these federal requirements for water management are continuing to emerge as part of this overall growing awareness, in your opinion, how should local authorities, different cities or states, outside the federal government, how should they be proactive to set standards and building requirements? In your opinion, if we could make you, ruler for a day, you could do whatever you wanted to. Well, how would you look at it?
What I think, these all should be in some way particularized, to the locality, to the region. We know there's a lot of variability from, state to state of Legionnaire's disease incidents. Different states are going to face very different water quality challenges in the future. In the Southwest, they're going to be doing more water reuse, which is great. It poses some challenges with Legionella and other opportunistic pathogen growth. That's going to differ in sort of what they should be looking at compared to, I'm in Pennsylvania. I think over the next 30 years, we're projected to get more water, which sort of causes its own but different issues with Legionella. So I think ideally there should be sort of different, people should be somewhat focused on different things, but the fundamentals, should be learn about Legionella, familiarize yourself with the relevant standards, guidelines, look at how other locations are applying them for now. So that learning, that could be the ASSE training we've been talking about. CDC offers Legionella training. There are a lot of really good, free resources out there you can use to sort of start to get an understanding of how Legionella operates. And then I think understanding the key standards and guidelines that are going to be referenced in code or regulations are really important. So that's, ASHRAE 188, Guideline 12, which gets into some more specifics and suggestions on Legionella, the Cooling Technology Institute Guideline 159 for cooling towers, and the CDC Legionella Toolkit, which is also a very good evolving resource. And then look at, how this knowledge and these documents have been integrated into other state or local codes. Frankly, this is a very small minority of places, but people have tried to take this on, like Michigan, particularly New York and New York City are really the big ones, and then Virginia within the context of schools. These sorts of policies are very difficult to implement, so take a critical view of how it's being done and what the results have been. I think if you are listening to this, you're sort of interested in getting this started in sort of a policy or code way. That would be my suggestion. But the broadest point, just keep an eye on it. Keep an eye on Legionella. Do not panic in response to finding what is a common bacterium. That should be, I think, a big through line in people's responses to it. Something Dr. Jen Stout always likes to say, she's got a lot of good lines, but this is probably my favorite. Our goal is 0 cases of Legionnaire's disease, not 0 Legionella. So if you are looking at policy around this, I think that, that phrase should be your guiding light.
I love it, Abe. And honestly, I'm smiling over here because one of the things you said, at the start of that answer, which was so well put, but what I just have to smile about is your point about, water quality differing from area to area. And, so solutions may be a little bit different from one spot of the country to the other. And this is something we at IATMO believe. We dub actually the term for this kind of occurrence as plumbing resiliency. And we have a whole website uniformcodes.org, that touches on this. And one of the things that we like to point out is that our code, the Uniform Plumbing Code, has, I think at this point we're up to 21, 24 appendices in the back, which are opt-in provisions. So if a jurisdiction adopts the Uniform Plumbing Code, they get the 17 first chapters, and then they have a pick and choose approach, sort of like customization option. And the way we think about it is, water does differ. Water needs do differ state by state. And so it sounds like what I'm smiling is because what I'm hearing is we're on the right path with this. Maybe there's always room for improvement, but giving different options, as plumbing codes and general plumbing standards, plumbing manuals and guidance documents, giving that opportunity to customize and tailor it for a local need. That's a key step in making a solution that's really thought through and offering the best potential opportunity to prevent something that is preventable.
Yeah. I mean, we are, I think, in 100% agreement. I mean, one of those contrasts that I keep bringing up is the difference between healthcare and non-healthcare facilities. They should have different standards. The risk is very different. The population is very different. They should have, different goals that, they're trying to meet. And that same sort of principle, applies to different cities, different regions, different states. So, I mean, allowing people the sort of guidance that they need when they are motivated and they have the right mindset to, arrive at a correct solution is, I think what we should be striving for.
I love it, Abe. Well, to wrap things up, first off, I got to say, I have just absolutely enjoyed having you on the podcast. I've learned so much from you today, and I think our listeners have as well. At some point, would love to have you come back. So, the next time we have you on the podcast, my last question here for you, the next time we have you on the podcast, what do you think we're going to be talking about when it comes to Legionella and policy?
I mean, if you had asked me that a year ago, I don't think I would have said anything that we talked about today, so I'm hesitant to offer a guess. I think one of the areas that's, if I had to bet on growth in this sort of water quality stock market, I would probably bet on the growth of non-Legionella pathogens sort of getting more and more integrated into standards and awareness. These are sort of briefly mentioned in the CMS 2017 memo, but they are not explicitly dealt with or tested nearly as much as Legionella. Legionella is really the poster child, but we, have some understanding that other pathogens like Pseudomonas aeruginosa, non-tuberculous mycobacteria, probably are as significant sort of causes of concern for disease. So I feel confident that will at least be sort of a relevant conversation.
I love it. I think that's very astute, Abe. Well, on behalf of the Authority Podcast, Plumbing Mechanical, I want to say it has been an absolute pleasure to have you here. Thank you so much for your time and sharing your expertise and knowledge with our listeners. And we really look forward to having you on again in the near future.
That sounds great. Yeah, call me anytime.
Thank you for joining us on this week's episode of the Authority Podcast, Plumbing and Mechanical. Love this episode of the podcast? Head over to iTunes to subscribe, rate, and leave a review. Please follow us on Instagram at IAPMO, on LinkedIn at IAPMO, or email us at iatmo@iatmo.org. Join us next time for another episode of the Authority Podcast, Plumbing and Mechanical. And in the meantime, let's work together to make our buildings more resilient and shape us for the better.